There is a medication that has been prescribed to seniors with weight-related health conditions for the past several years that most could never afford. The cash price for 1 month's supply has been running as high as $699. Medicare did not cover it for weight loss. Private insurance rarely covered it without a fight, and seniors who needed it most were the ones who could least afford it. On the 1st of July 2026, that changed. Medicare launched a program called the GLP-1 Bridge that brings the monthly cost of specific weight loss medications to $50 flat. Not $200, not $300, $50 per month, regardless of which covered drug you take or what dose you are on. An estimated 3.8 million Medicare seniors meet the clinical criteria to qualify. Most of them have no idea this program exists. Let me put a face on what that number means. Barbara is a 72-year-old retired librarian, BMI of 33, a history of prediabetes, and one prior heart attack. Her doctor recommended a GLP-1 weight loss medication 2 years ago. The cash price was $549 per month. Medicare would not cover it for weight loss. She tried for months and eventually stopped trying. She assumed that door was permanently closed. Her daughter found this program last week. Barbara's doctor is submitting the paperwork now. $50 a month starting this month. Nothing about her health changed. Nothing about her Medicare changed. One federal program launched, and the number went from impossible to manageable. My name is Mason Parker. For over a decade, I have studied retirement benefits, senior tax programs, and the financial rules that affect seniors every year. This program is days old. Most seniors have not heard about it, and many doctors have not yet learned the new process required to access it. That is what this video fixes. Before we get into eligibility, subscribe right now and turn on the bell. Next week, I am covering a Medicare rule that specifically affects people paying a premium surcharge based on income they stopped earning and the single form that stops it. Subscribe now so that video finds you when it posts. 5 things I want you to hold on to through this entire video. First, there is an oral pill option for this program that most coverage has not mentioned. Second, there is a BMI rule that works completely differently from what you might expect and protects people who have already lost weight on one of these medications. Third, the $50 you pay each month does not count toward your Part D annual out-of-pocket cap, and that has a specific financial implication worth understanding. Fourth, most primary care doctors have not yet learned the authorization process, and if you call without knowing what to tell them, you may wait weeks longer than necessary. Fifth, one specific formulation of a covered drug will get your prescription automatically rejected at the pharmacy. All 5 are coming. Let me walk through the 4 eligibility requirements, because each one has a detail inside it that most coverage of this program has not explained clearly. The first requirement is active enrollment in a Medicare Part D prescription drug plan. That is either a standalone Medicare Part D plan or a Medicare Advantage plan that includes drug coverage. Most Medicare beneficiaries who have any drug coverage already meet this requirement automatically. Plans that do not qualify include private fee-for-service plans, PACE organizations, and certain cost contract plans. If you are unsure what type of plan you have, call 1-800-633-4227 or check the front of your insurance card. The second requirement is where the most important exclusion lives, and it is the one most seniors get wrong when they first hear about this program. The GLP-1 Bridge covers these medications specifically for weight management. If you have type 2 diabetes, you are not eligible for the bridge. But here is why that is actually good news rather than a disqualification. Medicare Part D already covers GLP-1 medications like Ozempic and Mounjaro for type 2 diabetes under your regular drug plan. You do not need the bridge because you are already covered through your existing Part D benefit. The same applies if you have moderate to severe obstructive sleep apnea or a condition called MASH, which is a form of fatty liver disease. Part D already covers GLP-1 medications for those conditions as well. The bridge exists specifically to fill the historic gap for seniors who need weight loss treatment but have never had a diagnosis that qualified for Part D coverage. That is the population this program was built for. The third requirement is the BMI criteria, and this is where the most important detail in this entire video lives. There are three BMI tiers, and each one determines what additional conditions, if any, are required alongside your weight. If your BMI is 35 or higher, you qualify on that number alone. No additional diagnosis required. If your BMI falls between 30 and 34.9, you qualify if you also have at least one of the following conditions: heart failure with preserved ejection fraction, uncontrolled high blood pressure being managed with two or more medications, or chronic kidney disease at stage 3A or above. If your BMI falls between 27 and 29.9, you qualify if you have prediabetes, a history of a prior heart attack, a prior stroke, or symptomatic peripheral artery disease. Now, the rule that will matter most for a significant number of people watching this and that almost no coverage of this program has clearly explained. BMI eligibility is assessed based on when you first started a GLP-1 medication, not your current BMI today. If your doctor first prescribed you a GLP-1 in 2024 when your BMI was 37, and your BMI has since dropped to 33 because the medication worked, you still qualify for the bridge. Your doctor simply attests to what your BMI was when therapy first began. If you started at a BMI of 29 with a history of prediabetes before you ever enrolled in Medicare and your BMI is now 26, your doctor can attest to the clinical criteria at the time you first initiated treatment. Weight loss is not a disqualification. It is proof the medication did exactly what it was supposed to do. This single rule makes millions of seniors who have already been on GLP-1 therapy potentially eligible to transition to the bridge at $50 per month. The three medications covered under the program are Wegovy, which comes in both injection and oral tablet form, Zepbound in the quick pen formulation only, and I will come back to that specific detail because getting the formulation wrong produces an automatic pharmacy rejection, and Foundayo, an oral daily pill. Foundayo is the newest of the three, an orally administered medication called orforglipron that received FDA approval and was added to the Bridge program in April 2026. Most coverage of this program has focused on Wegovy and Zepbound injections and has not mentioned that a daily oral pill option now exists for seniors who prefer not to self-inject. If you or a senior you know has avoided looking into GLP-1 medication, specifically because of a reluctance to use an injection, Foundayo is worth asking your doctor about directly. The fourth requirement is that you are not currently receiving a GLP-1 medication paid for by your Part D plan. If your plan is already covering any GLP-1 medication for any reason you are not eligible for the bridge, you continue receiving your medication through your existing Part D coverage. There is one more element connected to the authorization process that your doctor needs to know before submitting. When the prior authorization is submitted, your doctor must certify that you are using the GLP-1 medication as part of a lifestyle program that focuses on diet and exercise. This is not a strict clinical intervention requirement. It means the treatment is being approached as part of a broader weight management effort and not as a standalone prescription. Most doctors will note this in your chart and certify it as part of the authorization. But if your doctor is not yet familiar with the bridge process, this requirement can cause a submission to be returned for additional information before it is processed. Now, the part that will actually determine whether you receive this benefit or spend weeks waiting because something went wrong at the authorization step. The process for getting a GLP-1 through the bridge works completely differently from any standard Medicare prescription your doctor has ever submitted, and most primary care physicians have not yet learned how it works, how the prior authorization actually works. This is not a standard Part D prior authorization. It runs through a centralized federal process managed by Humana on behalf of CMS. Your doctor does not submit the authorization to your insurance plan. Your insurance plan is not involved in this process at all. When your doctor understands this before they write the prescription, the process moves efficiently. When they do not, the claim stalls at the pharmacy while everyone tries to figure out where the paperwork needs to. Here is the exact sequence, step by step. Step 1. Talk to your doctor before your appointment and confirm you want to explore the Medicare GLP-1 bridge for weight management. Bring up your BMI history, specifically your starting weight when you first began or would begin GLP-1 treatment, and let your doctor confirm which eligibility tier applies. Step 2. Your doctor writes a prescription for one of the 3 covered medications and sends it to your pharmacy. The prescription must specify the medication is being prescribed for weight management. If it does not, the authorization request may be returned for clarification before it is processed. Step 3. The pharmacy submits the claim to the Bridge program's central processor using a specific billing channel. This is not your regular insurance. If the pharmacy is not yet familiar with the program, tell them the claim goes to the Bridge central processor and not to your Part D plan. Step 4. The claim will be denied automatically on the first submission, even if you are fully eligible. This is normal. It is part of the process and not a signal that something went wrong. The denial is what triggers the prior authorization request, which the pharmacy then sends to your doctor typically within 24 to 72 hours. Step 5. Your doctor completes a one-page prior authorization form with 12 yes or no questions confirming your eligibility, your BMI at the time of initiation, and the absence of any disqualifying diagnosis. This can be submitted electronically or by fax. Your doctor must wait to receive this request from the pharmacy before submitting the form. They cannot submit it proactively ahead of the prescription going through the pharmacy first. Step 6. Once the authorization is approved, it is valid through the 31st of December 2027 for that specific medication. No annual renewal is needed. If you switch from one covered GLP-1 to a different one at any point, a new authorization is required. If you change your dose within the same medication, no new authorization is needed. Step 7. You pay $50 at the pharmacy for each 3 zero-day supply. The pharmacy may ask for your Medicare ID number or the last 4 digits of your Social Security number to process the claim through the Bridge billing channel. Now, here is what to say to your doctor before your appointment, because this single paragraph of context can save you weeks of back and forth. Tell them, I want to access the Medicare GLP-1 Bridge program for weight management. The prior authorization does not go to my Part D plan. It goes to the CMS central processor through Humana. The way the process works is that the pharmacy submits the claim first, receives an automatic denial, and then sends you the prior authorization request within 24 to 72 hours. Please wait for that request from the pharmacy before submitting the authorization form. That is all they need to hear. A doctor who understands those 3 sentences will navigate the process correctly on the first attempt. A doctor who submits a prior authorization proactively to your Part D plan before waiting for the pharmacy denial will find the request going to the wrong place entirely. If your doctor has questions about the process or needs additional guidance, the Bridge program has a dedicated call center at 855-273-0102, available Monday through Friday from 8 in the morning to 7 in the evening Eastern Time. This number connects specifically to staff familiar with the Bridge authorization process and is separate from the general Medicare helpline. One more thing before we get to the 5 traps in the next section, because it is already happening around this program, and I want you to hear it before you make any call. As word spreads about the $50 GLP-1 program, calls are arriving claiming to help seniors enroll for a fee. A caller identifies as a Medicare enrollment specialist or a GLP-1 access coordinator and offers to handle the entire process for an upfront payment or a monthly fee. The Bridge program is free to join. The only cost you pay is the $50 monthly copay at the pharmacy when you pick up your medication. No one can charge you an enrollment fee, a processing fee, or any amount to access this program. If anyone contacts you claiming they can get you into the GLP-1 Bridge for any payment, that is the scam and net call. The only official website is medicare.gov GLP-1 Bridge, and the only official number is 1-800-633-4227. The $50 you pay monthly through this program sits completely outside your Part D $2,100 annual out-of-pocket cap. Your regular medications keep building toward that cap on a separate track. Understanding how your full Medicare cost picture fits together, the Part D cap, the IRMAA surcharge, the Extra Help program, and now the Bridge is exactly what the Senior Money Defense Playbook covers in one place. The link is in the description below, or scan the QR code on your screen right now to get your copy directly. Now, the 5 things about this program that most people will not find out about until they hit them directly. 2 of them affect your wallet immediately, 1 requires action before the end of this year, and 1 is specific enough that getting it wrong produces an automatic pharmacy rejection on day 1. Before I go through all 5 quickly, if you are still watching and have not subscribed yet, this channel covers exactly this kind of new information every week. The rules that started working for you or against you that nobody called to explain. Subscribe right now and turn on the bell and let us go through all 5. Trap 1. The $50 does not count toward your Part D annual out-of-pocket cap. In 2026, Medicare Part D has a $2,100 annual out-of-pocket cap. Once you spend $2,100 on covered Part D drugs in a calendar year, every covered prescription for the rest of the year costs you nothing at pharmacy counter. The $50 you pay every month through the GLP-1 Bridge does not count toward that $2,100 ceiling. The Bridge operates completely outside the standard Part D benefit. Your monthly Bridge copays accumulate on a separate track and do not move you any closer to the point where your regular medications become free. This means a senior paying $50 per month through the Bridge for a full year spends $600 that has no effect on their Part D cap progress. If they also take other medications building toward the $2,100 threshold, those 2 tracks run completely independently. The financial planning implication is straightforward. Do not factor your Bridge copays into your calculation of when your Part D coverage will reach the cap. They are counted separately. Trap 2. Extra Help cannot reduce the $50 copay. Extra Help is the federal program that helps low-income Medicare seniors with Part D drug costs. With Extra Help active, most prescription copays drop to $5.10 for generics and $12.65 for brand-name medications. Extra Help cannot be applied to the GLP-1 Bridge copay. The $50 is fixed regardless of income level or Extra Help status. A senior who qualifies for full Extra Help and pays $50 for every other prescription they fill will still pay $50 per month for their GLP-1 through the Bridge. GoodRx manufacturer discount cards and any other third-party savings programs also cannot be applied to reduce the Bridge copay. The $50 is the floor and the ceiling simultaneously. For seniors on very limited incomes, this is worth understanding before starting. The $50 monthly commitment does not flex downward the way other Part D costs do for Extra Help recipients. Trap 3. The Zepbound formulation problem. Zepbound comes in multiple physical forms. The GLP-1 Bridge covers only the quick pen formulation. The single-dose vial and the single-dose pen formulations of Zepbound are explicitly excluded from the program. If your doctor writes a prescription for Zepbound without specifying the quick pen formulation, the pharmacy claim will fail automatically, not because you are ineligible, because the product code on the prescription does not match what the Bridge covers. This is one of the most common early rejection issues being reported since the program launched. The fix is simple but requires one specific word. When speaking with your doctor about Zepbound, say Zepbound Quick Pen formulation as covered under the Medicare GLP-1 bridge, not simply Zepbound. The specific formulation must appear on the prescription for the bridge claim to process correctly. Trap 4. Manufacturer coupons, good RX, and payment plans cannot be used. Eli Lilly and Novo Nordisk both offer manufacturer savings programs and assistance cards for their GLP-1 medications. These cannot be stacked with or applied to a bridge program claim. The Medicare prescription payment plan, which allows beneficiaries to spread drug costs across monthly payments throughout the year, also cannot be used for bridge copays. The $50 is due each month at the pharmacy at the time of pickup. There is no installment option and no third-party reduction available. Trap 5. The December 2027 cliff and what to do before the end of this year. The GLP-1 bridge is explicitly temporary. It ends the 31st of December 2027. What comes next is not fully established. CMS designed the bridge as a transition toward a longer-term Medicare coverage framework called the balance model. But in April 2026, CMS announced it is delaying the Part D component of the balance model for 2027. What the coverage landscape looks like for GLP-1 weight loss medications after December 2027 is genuinely uncertain right now. Here is why this matters before the end of 2026 specifically. Medicare's annual open enrollment period runs from October 15th to December 7th. During that window, seniors who have started on a GLP-1 through the bridge need to confirm whether their current Part D plan has opted into the balance model framework for potential 2028 coverage. If a plan has enrolled in the balance model and the framework proceeds as currently designed, beneficiaries may be able to continue their medication under that coverage after the bridge ends. If a plan has not enrolled, beneficiaries may find themselves without coverage for their medication when the bridge closes on the 31st of December 2027. The action here is specific. In October 2026, when open enrollment begins, call your Part D plan and ask directly whether it has enrolled in the balance model for 2028. If the answer is no or unclear, use the plan finder at medicare.gov to compare participating plans during the open enrollment window before it closes December 7th. This is a one-time action that needs to happen in October and November of this year. Mark it on your calendar now so it does not slip past you during open enrollment when every mail piece and advertisement is competing for your attention simultaneously. Let me bring everything into one clear list so this does not stay as information you heard and forgot. 5 actions, all of them available today. Action 1. Check your eligibility right now. Go to medicare.gov/GLP-1 bridge and use the eligibility tool on that page. It asks a few questions about your BMI history and health conditions and gives you a preliminary answer in about 2 minutes. You can also call the dedicated bridge call center at 855-273-0102 Monday through Friday from 8 in the morning to 7 in the evening Eastern Time. This is not the general Medicare line. It connects specifically to staff trained on the bridge program. Action 2. Before your next doctor appointment, prepare what to say. Tell your doctor, I want to explore the Medicare GLP-1 bridge program for weight management. The prior authorization goes to the CMS central processor through Humana, not to my Part D plan. The pharmacy submits the claim first, receives an automatic denial, and then sends you the prior authorization request within 24 to 72 hours. Please wait for that request before submitting the form. That one paragraph prevents most of the delays that are currently happening as doctors learn this new process. If your doctor needs additional guidance, point them to the provider information page at cms.gov or give them the Bridge Provider Call Center at 855-273-0102. Action 3. If Zepbound is the medication your doctor recommends, confirm the prescription specifically says quick pen formulation. Say those two words directly. The single dose vial and the single dose pen are not covered. The wrong formulation produces an automatic rejection at the pharmacy on the first attempt. Action 4. If you are on extra help or have a tight monthly budget, understand before you start that the $50 monthly copay cannot be reduced by extra help, good or X, manufacturer savings cards, or the Medicare prescription payment plan. The $50 is fixed. It also does not count toward your Part D $2,100 annual cap. Plan your monthly budget with that number as a separate fixed line item that does not interact with your other drug costs. Action 5. Mark October 15th on your calendar today. When Medicare open enrollment begins in October, call your Part D plan and ask whether it has enrolled in the balance model for 2028 coverage. If the answer is no or unclear, use Medicare.gov to compare plans during the open enrollment window before it closes December 7th. Seniors who start on a GLP-1 through the bridge and do nothing during open enrollment may find themselves without coverage when the bridge ends the 31st of December, 2027. 3.5 million seniors are waking up this week still paying $549 or $699 per month for a medication their doctor recommended or not taking it at all because the price made it impossible. A federal program that brings that number to $50 started 4 days ago. The only thing standing between most of those seniors and this program is knowing it exists and knowing how the process works. That is what this video was. This program is one piece of a larger Medicare picture that most seniors are navigating without complete information. There is the Part B premium surcharge running based on income from 2 years ago that one form can stop. There is the Medicare Savings Program that eliminates the Part B premium entirely for seniors whose income falls within ranges most assume they cannot meet. There is the Social Security earnings record error quietly reducing monthly checks with no notification ever sent. There is the bank account rule that can freeze your Social Security deposit before it reaches you. I put all of it into the Senior Money Defense Playbook. Every rule explained in plain English, every government form named, every phone number listed, every action step written out, so you know exactly what to do and exactly when. The link is in the description below this video and in the channel bio, or scan the QR code on your screen right now to get your copy directly. It is called the Senior Money Defense Playbook. Subscribe and turn on the notification bell. Share this video with one person on Medicare who has been told they cannot afford a GLP-1 weight loss medication. The program is real. The price is $50. The door opened July 1st. They just need to know it is open. I will see you in the next one.